So this is a dressing change with irrigation and packing for an acute injury. So you want to bring your supplies into the bedside and raise the bed to a comfortable working height. 20 minutes prior, you want to assess for any pain and administer prescribed pain medication if needed. You then want to prepare your supplies, set up your biohazard bag, and perform hand hygiene and don gloves. You then would expose the site on the patient and place an absorbent pad underneath them. Then you would remove the current dressing and discard it in the biohazard bag, like so. And then you want to, if the wet dressing is adhered, you would use normal saline to release it. Then you want to remove the packing. So with your forceps, okay, remove the packing, making sure you get all of it. And then you'd assess the wound, and you would measure the wound's dimensions, including width, length, and depth, and if there's any tunneling, you want to measure that. And you use a wound measuring guide and a cotton-tipped applicator. You then discard of the guide and the applicator, and you would set up your irrigation supplies. So you need a large syringe and your irrigant solution. You would draw up the irrigant solution into the syringe and place the syringe so that you are able to aim directly into the wound. And you want to go from the least infected, least dirty side to the most dirty side. And you want to make sure that you're directing the stream of the irrigant fluid directly into the patient's wound so that you're not introducing any bacteria. And you're going to use some gauze to help catch and clean it up as it's going, making sure to get it away from the wound. Then you would remove your gloves, perform hand hygiene, and don sterile gloves as this is a sterile procedure. You want to make sure that you are maintaining a sterile field, and you would then take your new packing. With forceps, you gently want to put it back into the hole, making sure that you are only using one piece because that way the next nurse knows that she will be removing all of the packing material once it's out. And you want to make sure that you're getting through any tunneling. This can be uncomfortable for your patient as well. Okay, and then you want to don a new dressing. And you would date and label this dressing if necessary, if that's what your facility requires. You then would remove your gloves, perform hand hygiene, and don new gloves, and remove your supplies and discard of them properly.